Any woman that's had a UTI, I think would say the same thing. It's extremely uncomfortable. You feel a burning sensation. It actually makes me feel like my personal hygiene is off. And I find that extremely uncomfortable feeling emotionally and physically. What you really want to do is get rid of that annoyance as soon as you can so you can get on to your daily lifestyle. I've always been privileged to have a physician that I could get into very early. But very early has changed over the years. Very early used to be able to get in within 24 hours. Now very early seems to be 5 to 7 days if you're lucky.
For the most part, pharmacies are open 7 days a week. They're open evenings and weekends, and it can mean that a woman can get seen quicker than they could.
I had a UTI about 6 months ago, and I walked into my pharmacist, and I asked my pharmacist if I could have a private conversation with him. We went into his patient consulting room in privacy, and I sat down with my pharmacist, and I said, I'm quite sure I have a UTI. And my pharmacist asked me about 6 or 7 questions, I think, to confirm that I had a UTI based on how I was presenting clinically.
The first one I generally ask is, tell me about your symptoms. That then leads into an open-ended discussion around the symptoms they've been experiencing. I would also ask them how long they've been experiencing these symptoms, whether they've had a urinary tract infection before. If they have had one before, how long ago since they last got it. Was check in to make sure they don't have any fever or chills, that they don't have any flank pain or pain further up their sides. There's signs that are more indicative of infection further into the kidney and it would require referral. And after a discussion, if it was decided that the symptoms were indicative of a urinary tract infection and there wasn't any areas that I would be concerned about that would require referral to another specialist, I'd likely prescribe a medication to help treat the symptoms.
He said, take all of them, but you should feel relief from this medication in 24 hours.
So one of the common questions the patient may ask when they come to the pharmacy for this service is, do you need a urine sample? And the answer honestly is no. Urine analysis really isn't required. We can assess and treat for a urinary tract infection based on the symptoms that the woman presents with. We always follow up, and again, this is a service that the patients certainly appreciate, and it also helps guide clinical decision making for me by following up with the patient in an appropriate length of time, 3 to 5 days after treatment has been initiated. You can find out have symptoms been resolved, if they've had any side effects with the medication, and again, this just helps reaffirm my treatment decisions. Patients are always my #1 priority. They are what kind of fill my cup, as it were. It's not the day-to-day operations of the pharmacy. It's really making that connection with the patient that kind of makes me tick.
Paul has that special balance of knowledge and care, that caring personality. I would absolutely recommend any woman with a UTI to go to the pharmacy. It's a no-brainer, okay? When you're suffering from a UTI, time is of the essence to get the medication and get back to life without the irritation of a UTI.